First, they have to have a terminal condition that the physician feels that they have a 6-month or less life expectancy. And the second thing is that they're looking for comfort-focused care rather than curative-focused care. So if it's a cancer patient, for example, and they're doing active chemotherapy or radiation, they wouldn't qualify for hospice while they're doing that. But sometimes then when they finish those treatments, then we can look at hospice for them. So I usually tell people that there's 3 main things covered by the benefit of hospice. 1 is people, 2 is equipment, and 3 is medications. So that hospice benefit covers those 3 areas. As far as the people go, that's the hospice staff that will come to the home to provide care. And we're the support team for the family there. We're not with them 24 hours a day, but we teach them how to provide the care.
Well, it's a very rewarding role to play. I think most people who are use the gift of caring for people are very spiritual people. And so the thing I get to be involved in is helping our spiritual people take care of spiritual people at a spiritual time. When we're faced with the reality, or really it's always a reality, where we acknowledge the fact that we're not always going to be in this world. We're all going to make a journey at some time when our heart stops beating and our lungs stop breathing. We ask ourselves, what is the meaning of life and what is possibly in my future? So I get to walk with patients and families down that road. The goal that I have as their hospice chaplain is that they first not be afraid to make the journey. And the second is that they be at peace. And the third is that they find meaning and purpose in each day that they're given.
It's a special time for the family to be around at end of life. Not to say that it's an easy time, but it's important to be there for the family members. And our job really is to make sure it goes as smooth as it can. So we may be teaching them to provide the care. We might be facilitating a family meeting if there's some issues that they want to work through before the patient passes away.
In many cases, patients and families that don't have a faith connection are able to benefit from our program as well because they receive the spiritual care that they might not otherwise have. Part of my role is helping patients to come to terms with their own mortality and to help them to discover their spiritual and religious resources that they can then use in their care plan and in their specific needs at that time.
As a cancer patient myself, and also being surrounded by a lot of friends who deal with life-threatening disease, I feel like we have a little bit of change of attitude about all of this. You certainly don't take things for granted as much, and you try to live each day fully. But I also think that I personally have less fear of death as a result of my cancer diagnosis. It's certainly not a pleasant thing to have to deal with the treatments and the doctor visits and all the things that you go through. However, knowing that, that you're still here, you're still alive, you can still live fully, and then by not living in fear and not fearing death anymore, you can even live that even more.
I'm able and equipped to serve not only spiritual needs of our patients, but also the emotional, relational, and social needs as well. That kind of goes beyond the spiritual aspect of what we provide too. It's absolutely essential for families too. It's equally as important for families as it is for hospice patients, because a lot of times when the hospice patient admits to hospice, the family's already grieving and they're struggling with how they're going to deal with the situation with their loved ones. So the hospice team comes alongside them and provides that emotional support.
Most people are reluctant to talk about hospice and they don't want to talk to us initially. But once they get on the service, they realize what a benefit it is to them and oftentimes say, I wish we would have done this sooner.
And as soon as I knocked on the door, he says, "Come in here, Chaplain, I want to show you something." I said, "Yes, sir." So he walked me back to his bedroom. He pointed to a clock that was up on his dresser. He said, "Chaplain, you see that clock? It was one of those old ones that had the flip dials that flipped the time minute by minute." He said, "Chaplain, many nights I'll lay awake and I'll look at that clock. 11:58, 11:59, 12 o'clock. I got another one. That's the way I live, Chaplain. It's a pretty good way to not only die, but it's a pretty good way to live, to celebrate the gift of every sunrise and take advantage of all that it can give us.